During the second half of the 1900s, doctors moved into two areas hardly explored before: organ transplants and artificial organs. Doctors had attempted blood transfusions in the 1800s. These transfusions were hit-or-miss affairs. The process proved too dangerous to be practical. Sometimes the patients lived, often they died. In the early 1900s, doctors learned that blood can be of four types: O, A, B, and AB, and have two factors, Rh positive and Rh negative. Blood type is not based upon race or nationality. An Irishman can have the same blood as a Native American, yet have blood different from that of his own relatives. Suppose samples of blood from two individuals are mixed. The samples will either mix completely, or they may react with one another, forming blood clots. If the clots form inside the body, death results. Doctors learned how to tell if blood transfusions could be made successfully. They based the rules upon the blood type. Blood of type O can be donated to any individual. Blood of type AB can only be given to others with the type AB. In the United States, Dr. Charles Richard Drew was a pioneer in using blood transfusions and in establishing blood banks. When properly stored, blood can be kept for about a month. Like our muscles, heart, and kidneys, blood is a collection of cells with a special purpose. A blood transfusion is really the first step toward organ transplants from one individual to another. Before 1954, no organ had ever been successfully transplanted from one human being to another. During that year, Ronald Herrick donated one of his kidneys to his identical twin brother, Richard Herrick. Normally, Richard's own defense system would have rejected the kidney as a foreign body. However, since the two young men were identical twins, their organs could be transplanted without fear of rejection. One of the most dramatic events in medicine of the 1900s took place in the operating room of Groote Schuur Hospital in Cape Town, South Africa. On December 3, 1967, Dr. Christian Barnard transplanted a heart. The heart came from a human being who had died in an automobile accident. Dr. Barnard put it in another human being who was dying of heart disease. The accident victim and heart patient were not related. Christian Barnard had to overcome the problem of rejection. Rejection can be controlled, although not eliminated entirely, by special drugs. These drugs help the body tolerate foreign organs. The same drugs prevent the body from fighting disease bacteria. It's a delicate balance. Keep the body from rejecting the transplanted organ, yet do not weaken the defenses so much that infection kills the patient. Another solution for a failing organ is to replace it with an artificial one. Paul Revere made false teeth out of animal bone. Ambroise Paré made artificial legs and arms for his patients who had their own limbs amputated. Many body parts have artificial replacements. During the 1940s, Dr. Willem Kolff, working in Holland, developed the basic idea of an artificial kidney. Our kidneys are absolutely essential for removing waste products from the blood. Dr. Kolff's machine made it possible for waste products to be removed, but the blood itself to be unharmed. Dr. Kolff took his design to the United States. There he built the first kidney machine. It was large and complex. The patient had to regularly go to the hospital for treatment. At first, far more patients asked for treatment than the machines could serve. Doctors had to make the heart-rending decision about whom to treat and whom to send away. Devices like eyeglasses, hearing aids, and kidney machines operate outside the body. Artificial parts can be placed within the body, too. Heart pacemakers help regulate the speed at which a heart beats. Replacement parts for knees and hips are placed in the body. One goal is to make kidney machines and even artificial heart pumps that will fit inside the body. How many of these ideas will turn out to be breakthroughs in medicine? In many cases, it is difficult to decide right away whether or not a discovery is really a breakthrough. Time must pass before we can judge the merit of a discovery. For example, Alexander Fleming discovered penicillin in 1928, but it didn't come into common usage until the 1940s. Leeuwenhoek first noticed bacteria in the late 1600s. 200 years passed before the importance of his observation became obvious. Of course, a breakthrough may instead be a blind alley that causes more harm than good. As we have seen, doctors followed the four-humor theory of Hippocrates for 2,500 years. Yet it, in the practice of bloodletting, proved to be dangerous to patients. In the 1950s, James Watson and Francis Crick of England made a model of DNA. This double helix molecule passes traits from parents to offspring. DNA contains the genetic code that describes to the body how it is to grow. In the late 1900s, research facilities all over the world began mapping the human chromosomes. A complete map will go a long way to identifying the cause and prevention of hereditary diseases. One way that doctors can use the map is to search for ways to treat and reverse the progress of diseases such as muscular dystrophy. Late in the 1990s, modern medicine became more aware of the importance of treating the whole person. Hippocrates said, "Illness is sometimes stronger when a mind is troubled." Ambroise Paré once built a machine to make the sound of falling rain to lull to sleep his patients who were in pain. Doctors are once again realizing the role of love and support from family and friends, strong faith, and a positive outlook. This idea that the whole person should be treated and not a specific symptom is known as holistic medicine. Although not a new idea, it may take a stronger role in the future treatment of patients. One fact is certain: breakthroughs in medicine can come from any direction. Look at the occupations of those whose discoveries are described in this book. A janitor, Leeuwenhoek; a barber, Paré; a dentist, Morton; a chemist, Pasteur; nuclear scientist, Röntgen; and yes, even doctors. This book has looked at the key discoveries of medicine. Who knows what our next major medical breakthrough may be?